summer of 2023, my family, extended family and all, was headed to Hawaii to celebrate my grandma's 70th birthday. My mind was focused on the beaches I would lay on and the sand that would move between my feet. It was a 2-week vacation, and I was beyond excited. 60 minutes into the 5-hour flight, I felt a throbbing sensation in my back. It was a pulsing pain, almost like a painful heartbeat. I popped a tablet of ibuprofen and focused back on my college PIQs with the thought of the Hawaiian Sunset Cruise in the back of my mind. We were less than a week into the trip when we learned that my grandfather had passed away. Being surrounded by family helped to navigate this emotional pain, but no more than 20 minutes after we found out the news, that emotional pain led to physical pain that was insurmountable. A pain that felt as though a knife was stabbing me in the back multiple times, refusing to stop. I was exhausted, fatigued. I could not get out of bed. I spent hours laying down, praying, wishing that the pain would stop. I spent 50% of my time in paradise, lying ill in a bed and having to cancel plans that were already made. I was reminded of the old pain episodes I had before and believed that there was hope for this one, which felt a million times worse. In spite of my continuous wishing, this unbearable pain did not stop, and on the 20th of June, I was rushed to the hospital. After being evaluated and hooked up to an IV with hardcore opioids running throughout my body, I was released from this insufferable pain. Sickle cell pain is something that I have dealt with my entire life. My routine, since at least the age of 11, has consisted of taking a small pink and purple pill with a name that I still struggle to pronounce, hydroxyurea, every single night. Long doctor visits take up summer vacation days. Days of school are missed. I fall behind on classwork. I cancel plans. And I may come up with reasons or excuses for the reasons as to why I can't swim or why I have never seen snow. Sickle cell disease is a common genetic disorder that mainly affects African Americans. There are many different types, with sickle cell anemia, or hemoglobin SS, being the most prominent and severe form, and which is the one that I was diagnosed with. Approximately 100,000 Americans live with sickle cell. The disease changes the shape of red blood cells and causes them to form into a C shape, which is called a sickle. These cells die early, which causes a constant shortage of red blood cells. Additionally, the unique shape makes it difficult for these red blood cells to flow smoothly through blood vessels. As a result, they get stuck and block blood flow, reducing the oxygen delivery to tissues and organs. When this happens, many sickle cell patients characterize this as a pain episode or pain crisis. The pain can occur in any part of the body and can last from a couple hours to a few days to even weeks on end. Many have compared the feeling to as being stabbed by a knife or as though glass is flowing throughout the body. Triggers that can cause an episode to happen include change in weather or temperature, physical or mental stress, dehydration, and many other factors. Because of sickle cell, pain is a constant presence in my life. And as a Black woman in America, I have seen the discrimination firsthand when patients seek medical treatment, and I believe that this is an issue that is largely overlooked. Confronting racial bias and discrimination in pain treatment, particularly for patients who experience sickle cell pain on a day-to-day basis, can create a better medical environment for Black patients. The history of mistreatment towards Black patients can be dated all the way back to the 1800s, when enslaved men and women were used as experiments to facilitate a need for white doctors. With the belief that Black people's skin was much thicker than those of white skin and that they can endure more pain, the doctors carried out life-threatening procedures on these men and women. A man by the name of James Marion Sims, who is known as the father of gynecology, experimented on enslaved Black women and girls between 1845 and 1849 to help develop a technique for the complication of childbirth. These dangerous procedures continually risked the lives of these men and women, and he even drugged them so that they could not resist. One enslaved teenager was subjected to at least 13 different operations without the use of anesthesia before he came up with a technique that was used to administer on white patients. He used these black women and girls for the advancement of science and medicine, a science and medicine that was meant to only benefit white people at the time. This mistreatment continues even today. Research shows that Black Americans are systematically undertreated for pain compared to white Americans. A 2016 study done by the Proceedings of the National Academies of Science found that medical trainees believe that Black people are less sensitive to pain as white people and were less likely to treat them accordingly. This leads to pain being ignored, disregarded, and a systemic undertreatment of pain for Black Americans. This insane belief leads to the assumption that Black patients are abusing the medications that are prescribed to them or lying about pain to get higher dosages of medicine. Research shows that Black patients have been called drug seekers or pill poppers. In fact, the origin of the opioid crisis first began in white communities and skipped over Black communities because Black Americans' pain wasn't believed. So those opioid medications were not prescribed to them. Black patients are often turned away from being prescribed accurate pain medication, which results in their pain increasing and can often put them in life-threatening positions. Patients sit in emergency rooms begging and pleading for stronger medications to help their pain, but are often shrugged off and ignored. This medical injustice doesn't just pertain to pain either. Data from Pew Research Center shows that a large percentage of Black women are said to have had at least one negative healthcare experience. Because of these negative healthcare experiences, these women are also said to have preferred a Black healthcare provider as they would do a better job than those of any other races or ethnicities at providing them with quality healthcare. Physicians have reported preferences for white patients over Black patients and have expressed views that they are more medically cooperative than Black patients. As physicians, humans have subconscious biases, and subconscious biases linked to Black patients have been associated with changes in the way that physicians communicate and treat their patients. For far too long, this injustice has been happening, and it is about time that Black women such as myself speak up on these disparities we face. When we break these implicit biases and take the time to educate ourselves on these issues that people face on a day-to-day basis, we can come up with ways to help patients who are simply asking their doctors to handle their health with care. Ways that we can achieve moving into more comfortable spaces is if doctors and physicians were to take more time to educate themselves on specific diseases that affect different demographic groups, such as sickle cell, so patients will feel more trust towards their doctors. Along with that, many more doctors of color are needed in today's world. People who can relate to their patients and create a lasting bond, resulting in a better healthcare system and accurate diagnoses and treatments. The future of medicine could have a big impact upon communities of color if we strive to live in a world where healthcare was easily accessible for an affordable price. So many more lives could be saved. For me, this would mean finally investing in the treatments I know are out there to help cure my sickle cell. I would no longer have to spend hours waiting in a hospital, waiting for pain episodes to stop. Patients would be given hope that they can soon live a normal life and not have to make round trips to hospitals and beg for medications to be prescribed. People would no longer have to suffer through pain and go through uncomfortable healthcare experiences. People of color would finally be believed, and words like drug seeking or pill poppers would no longer be used to characterize us. We would no longer have to hear about these horrendous stories about patients dying due to the ignorance of doctors. Voices would be heard and attention would be brought to the different diseases out in the world. People of color would finally feel as though their battles were worth fighting for. So let's normalize speaking upon these disparities so we can move towards that new future of hope. Thank you.